Hello, everyone. My name is Eric Chiverdi. I'm taking Jason Plord's Introduction to Kinesiology class, and today I will be interviewing.
Hi, I'm Andre Darbidian, Doctor of Physical Therapy.
So, jumping right into it with interviewing a professional kinesiology assignment. Question one: what would you wish you could know about physical therapy before you became a PT?
Well, prior to becoming a physical therapist, I wish I had a little bit more of a background on all the aspects of physical therapy, because I feel like, especially in California, we kind of just single out the outpatient setting. Often cases, schools and different communities don't really talk about, skilled nursing facilities, the impact physical therapists could have with doing wound care, or even, the inpatient setting, however, to a bigger degree. Because when coming into school, I know myself, what I knew was either it's inpatient or outpatient. So there was no other options presented to me. However, I know that now, obviously, I know more that physical therapists have a wider scope of practice.
Okay. Question number two: what could you change about your job field if you could change one thing?
Well, if I could change one thing about my job field, I'd probably say the amount of time that we need to spend with the actual patient. The one thing that, I know it's extremely necessary and obviously it's extremely important is documentation. However, they say if you if you don't document, it didn't happen. I wish there was a way that we can be able to spend some more of that time with the patient instead of documenting. However, again, it's part of the necessary part of being a physical therapist.
I've mentioned this to you in the past, and I vaguely remember your answer. But just to review, I came up to you and asked about a specific role in the PT office or in any setting for someone to follow around the therapist and document for them. But you said that this is a privacy or a liability concern. For someone to take documentation off of the therapist's hands so that your and other physical therapists' main focus can just be treating patients. How would that work?
Again, I've heard of studies doing that. However, for me as a physical therapist, I'm really into thorough documentation. So your documentation basically should look like if I were to leave for a day, or for, let's say, if I have a patient and I document on them, the next physical therapist or physical therapy assistant should be able to understand and even replicate what I did in that prior session and to understand why I did what I did. Also, kind of piggybacking on the first question that was asked of me, one of the most important things that I think every person that is trying to pursue physical therapy is to always ask why. I know one of my greater mentors, Dr. Robert Thunder, always told me, Andre, always ask why, because again, when you understand the why, you'll understand the how, and again, the reason behind certain therapeutic exercises, manual treatment, or even modalities.
Okay, so got it. Always ask why. So moving on, do you enjoy the work setting you're currently in? What work setting would you recommend for someone else? Maybe, someone like me that's uh, confused or ambiguous to the various settings.
Yeah, that's a great question. I actually had the privilege of doing a rotation. This was out in Texas, where I had a firm trial at different settings, from long-term facility, the LTACs, to SNFs, to the skilled nursing facilities, outpatient, inpatient, and even a bit of the acute wound care type setting. And for me personally, I am an outpatient ortho type of guy, so I love the setting that I'm in. However, with outpatient orthopedics, especially here in California, based on insurances, if you're not being reimbursed well by insurances, and again, this is a different can of worms that we can go down. If you're not being well reimbursed, you start to have to take on increased client load. Then you start to have less quality, more quantity with your patients. Again, I am currently in a setting where it's outpatient ortho. I also do work as a cash-based physical therapist in the orthopedic setting, which I prefer the most because I get the full time of my patients. And even though it is way harder to get clients to an outpatient cash-based orthopedic clinic, um, it's for me more rewarding because I get to spend more time and I get to truly work with the patient the way I would like to work with them without the constraints of insurance companies and having to justify why I did what I did, or even, give a time restriction. So those are the experiences that I have had coming, and I've been experiencing more and more throughout the year.
Would you say that in the cash based versus the insurance based, when you compare the two, you're doing, I would infer, less documentation when you're cash based, or does it mean more documentation because it's more time? How does the the ratio of patient time versus documentation time change between those two settings?
That's a great question, and again, it all is based on how well you can document. For example, um, when you're doing insurances, let me give you two major comparisons. Medicare, you have to be extremely thorough with your documentation and using jargon that is medical based.
Mm-hmm.
For example, you would have to write, the patient demonstrated good scapulohumeral movement on the session, requiring more inferior glides to help elevation of the shoulder, for example. In a, I guess, more cash based, you would only write patient, like you can even short write, patient requires increased shoulder flexion due to decreased scapulohumeral movement at the session. Again, it's what you want to provide so you can know what you did on that session. So again, if you don't, for example, for the Medicare example, if that is not, let's say, how I could word this, Medicare savvy, or like the wording is not adequate enough for Medicare to justify your treatment, they won't pay you. So that's another example of where you have to pretty much document thoroughly, document how they want to see, or you won't get paid for that session.
Do you think the way of documentation that they enforce is the right way, and the way that,
I believe so.
yeah? So if you could, so ideally every PT would document as if they're being watched by Medicare trying to make money.
In the aspect of the thoroughness, yes. However, again, when you are documenting, sometimes if you don't get exactly what you want out of a patient for that session, it becomes a little bit difficult when you want to tell a patient, like, hey, this is what's going on right now, and then you want to document that. Some of the jargon gets a little bit difficult to justify. And again, if you're not justifying your treatment, another great example comes, let's say if you're a patient and you have low back pain, right?
Common.
You come to, very common.
Yeah.
Probably my most common treatment, let's be honest. Say you have low back pain and, your low back pain has gotten better by the third and fourth session, and you happen to have knee pain. Now, in that session, your PT cannot treat that knee pain. They'd have to have authorization from your primary care physician to be able to treat the knee. In a cash-based setting, you don't need authorization since it is direct access. You can treat the knee on that session and do a little bit of low back stuff. So you can be able to, again, globally treat your patient rather than honing on one part.
So in that, now that you bring that up, let's say, you always used to tell me that the body is connected and there's a reason for everything happening. So let's say one injury translates and, becomes another one. For example, if you're going off of low back pain, I'm not a therapist yet, but that can, mean hamstring tightness, right? That can tug on, pull on, that can alter the, inhibition of different muscles and everything. So if it's, let's say, I could completely understand how, let's say if someone comes in for shoulder pain, knee pain is less likely to be connected to their shoulder than, something in the posterior aspect of the leg that's, you know, what I'm trying to say is where's the line? How close does it, when do you know you need further authorization?
Great question again. So, like I said, if it's two parts that don't really coincide together, low back and finger,
Yeah.
you can't really. Again, most insurances won't pay for you to treat that finger unless you have authorization for that. Like you are not allowed to treat that part.
Okay, makes perfect sense. I mean, that does come in, morally if you're genuinely a PT, as I know you are, and I aim to be, of someone that's just trying to help, and someone's just in minor pain and want you to check something out really quick, but you have to, make this big deal out of it. Hey, I need this, that, and then, at the end of the day, you're the bad guy, but you're doing the right thing. Yeah, for sure. All right. So this one's actually a big one. I plan to open up my own practice in the future, but I fear that I will be more of a business owner than a physical therapist. What advice or thoughts do you have on this?
That's actually another really good question because I was talking about this with one of my colleagues, and it is pretty difficult to just treat. I have a lot of my colleagues from school. They are completely content with just treating. Now, when you become a business owner, you have to remember that business is your baby. Okay? You can't be in the business. You can, but it's extremely difficult to be in the business while working on the business because as you're treating in the business, you also have to worry about that time that you could be spending treating, going out for referrals from doctors, marketing, promoting your business, managing your business, checking out your staff, making sure everything is running smoothly, running the numbers down, seeing where your profit margin lies. So that's when becoming a business owner becomes extremely difficult if you want to treat all the time. And I'm talking all the time as if 40-hour shift, you're treating the whole time. It becomes difficult. It's not impossible because, again, you just have to fortify that time treating and the other time promoting the business or working on the business. I have a very great analogy for this, and also in general, when I have patients that have multiple body part injuries, the way I look at it is if you think about this analogy, you have one horse, okay? You have one reader, okay? If you're riding that horse, mid ride, you try to jump onto another horse, you're probably not going to get the quality ride that you were looking for. You might even slip off.
Yeah.
So, again, work devoting your energy to one thing, I think, is more applicable and you'll get better results than if you're, doing something halfway, then you turn and do another halfway. Because again, the quality treatments, I believe, will start to decrease. And I have seen this in a couple businesses where the PT wants to stay treating, but unfortunately they're having a hard time managing their own PT, their PTs, their PTAs, and it becomes a little bit of a mix-up.
Right. So I find this a great opportunity to bring up actually one of the lessons we went on when learned about in class was role conflict. So a big one that I experienced when going through high school was teacher coach role conflict. And I would always notice that teachers that are coaches try to do the same thing, but it's tough for them to balance it. When they're teaching, they're thinking about coaching and scouting other teams and making sure their team is good, and do you have the CIF for high schools and all this. And when they're coaching, they're thinking about the pile of papers that's sitting at home, that they have to grade and everything. So going off of
Mm-hmm.
this idea from what you've seen, I don't know if you have a big enough sample size to answer, but would you imagine that business owners that are physical therapists or vice versa would do they usually prefer or favor the role as a business owner or as a therapist?
Mm. Well, again, I can't answer that question because I mean I can. I'll answer the best I can. However, without like I said, a sample size for me to be able to tell you the best way to approach that conflict is have a really good manager. Because when you're not there, that manager can oversee things that you can't see. Again, and when you're treating and you're on the floor, you'll see some things how your therapists are treating. But at the end of the day, when you're focusing on your patient case, and if you have a complicated patient, you tend to kind of hone in on that patient and you kind of don't see everything around you. And again, patient load, I mean, I see about 20 patients a day. You kind of really spend time to work on your patients, and it becomes difficult to take that hat off and become an owner. And I know one day when I become an owner, and hopefully the end of this year, I'll see a difference. And I anticipate that I would probably be treating less, working more on, again, promoting the business, trying to expand the business. Essentially, you become that business, the head of that business. You're no longer the head of treatments. And again, this is where having a good director comes into play, because the director can dissociate from the business and just be treating while you are doing the business aspects. Again, going after doctors, going after marketing, whatever you need to do to make that business better. Even small things like paper towels that are running out, because again, in a business there are so many variables. One day the hot packs might not be working. One day your Easton machine goes down. You run out of TheraBand. You run whatever it is. You have to remember, you need to cover all that because it's your business at the end of the day. You're the one running that business versus you're just treating. Does that make sense?
Yeah, yeah. Do you think the satisfaction is marginal? Do you think you would get tired of, stocking and, replacing paper towels and worrying about all that versus treating? Do you think that's something treating is you'll think about treating rather than you won't feel like a, because personally what I imagine, let's say I'm in your shoes, right? I've been treating for X amount of time and I open up my business, God is great, everything's going good, and then I go from treating to becoming a runner, or becoming I'm stocking paper towels, or I'm always at Costco. I've seen some of these things thanks to you, from your reference, but that's what I noticed. It brought a new light to me because I'm like, I don't want to go to 8 to 9 years of schooling, do rotations, all of that, treat for some time, and then just my day as a therapist becomes a Costco run, some gas, talking to a few doctors, and coming back and sitting and not treating. You know what I mean? That's just my perspective on it.
Yeah, again, it goes back to that analogy I told you of the energy using riding a horse. Personally, again, I anticipate that happening, and I know myself, I'll probably allot my time to treat 4 or 5 patients a day, just because, again, myself, my reason for becoming a physical therapist is my passion for seeing people get better. Biggest thrill, and people always ask me this question all the time: why PT? Why did you choose PT if you want to, for example, make money or whatever? Again, for me, it wasn't always about the money. It was always about the satisfaction of seeing someone that's never walked before begin to walk, seeing someone that's never climbed flight of stairs climb a flight of stairs, seeing someone who, again, is on crutches the first day. I'm done with them. They're walking. They're running much better. that thrill is what really got me into the field. And that actually happened to me when I tore my own meniscus and I went to physical therapy. Unfortunately, I didn't get the best treatment. So to me, I vowed to forever never let anyone experience what I experienced. And again, that's where my passion lies, knowing that being a business owner, my time is going to be devoted to opening up my practices and opening up businesses and doing all this stuff. I know my time will be divided. However, it's all about time management. And I'm sure I've told you this numerous times. No matter what you do as a PT aide, PT assistant, physical therapist, anything you do, time management is probably one of the most important parts of the field of physical therapy.
Gotcha.
Because if you can't handle your patient over here that's done with the hot pack that needs to be treated, or if you can't handle this patient that's doing therapeutic exercise while your other one is also doing exercise and you need to manage your time between them, ultimately you're going to fail. So again, time management is a key component that's not often brought up, but it should be.
Gotcha. Yeah, that's great. So continuing on, without giving me any figures or any personal information that you're uncomfortable with revealing, but in general, do you feel that PTs are underpaid? And how do you grow in the field of kinesiology as a PT financially?
Oh, that's a tricky question. I'll be honest with you. Some PTs are underpaid, others are fairly paid. It all depends on your ability to negotiate, your ability to understand your worth, and to see what you want to do. Again, this becomes another gray area because in California, again, insurances don't want to pay too much, especially if you're at, again, I hate to call it this, but a mill where, again, you have a bunch of HMOs and you're billing for a short amount of time. You're just overpacking. So it becomes quantity over quality. Most places, outpatient orthos don't want to pay a higher sum. If you're looking for the money, again, that's actually a really funny point. So when I first attended PT school, our professor said, all right, who wants to make a bunch of money? And obviously everyone raised their hand. Who wants to help people? A bunch of people raised their hands. And then they kind of told us, if you want to do both, you're in the wrong field. You can.
Yeah.
However, I don't know many people that became millionaires off being physical therapists just treating. I mean, again, from what I've seen, skilled nursing, inpatient, those fields pay a lot more than outpatient. But again, that's not to discourage you or anybody, because with your negotiating skills, or shoot, if you want to open up your own private practice, you can make millions. I never tell anyone they can't do it, pretty much.
Yeah. So you mentioned that it's from what I got when you started answering the question that you have to be able to sell yourself, right? Negotiate, and you mentioned one's worth. So what makes a PT's worth more?
Great question. For me, again, quality treatment, which means you're seeing progress, you're seeing results. Okay. Number 2, rapport, because tissues heal, the body heals. But one thing that a lot of physicians, a lot of healthcare workers need to understand is we're treating people, not a piece of paper, not an MRI report. We're treating people. If a person doesn't really like you, they're going to hold on to that. And that ties into the neurophysiological effects that come with physical therapy. That comes into your biosocial factors that come into physical therapy. It's like saying you're trying to get better, but you're always going somewhere you dread. If you're always thinking negatively about something, you're more than likely to not get better as quickly or as well as you would like, because again, you associate negative with that aspect. So again, patient rapport is extremely important. Just like I said, the best physical therapists made get the most amazing results. But if they have poor bedside manner, poor patient rapport, poor professionalism, those are all aspects that really, really can change a person's perspective on a physical therapist.
Gotcha. Yeah, that's a great answer, man. Makes perfect sense. Nothing to ask. Next up, do you work more with your body or with your mind as a PT? And I have a follow up reference or question. I remember you telling me one time that as a PT you're breaking your back for someone else's. After working for a while, do you still stand by that, or because
the term, what I actually said was, you want to protect your own back before you hurt you want to protect your own back before you can treat anyone else's. And what I mean by that, and to answer the first question, I now in my stage for sure think definitely with my mind more than my body, because I am signing off on PTA notes. I am kind of not the full managerial position, but as a more seasoned therapist at my place, I kind of oversee the flow of the clinic. So therefore, I am working more on my mind, and also it becomes the point where I'm doing a lot more evaluations where I have to always think what's going on, and two, I'm also really thinking of how to be more efficient with my treatment. And that takes a lot more of your mind. I would say you are using your body. Don't get me wrong. You're demonstrating exercises. You're doing manual therapy. But if you have good body mechanics, so I tell you, protect your own back before you try to help anyone else. You will tend to have less aches and pains. Great example is when I first started out, I would use my fingers a lot more than my PZ form. The PZ form is a lot more effective than the fingers because, again, you just put your body through it and actually trying to jab in. Again, so you learn little tricks of the trade that make you use your mind more than your body more as you become a more seasoned therapist.
Okay, and I'm guessing that falls into quality versus quantity as well. If you're seeing a lot of patients a day, right? That might translate you to obviously getting more tired, right? Because you're moving around more. But as far as the quality of patient goes, that can also, I'm guessing that reflects onto how efficiently you think and you act as a therapist. If you have now, sorry to cut you off, but do you find that you enjoy or you give how do I say this? You think clearer when you have less patience, I'm guessing. So is that, would you, how can I make this clear? Let's say with the example you gave versus, your fingers versus your wrist so you could follow through with the weight. Is that something that you would forget if you had a busy day, making the quality of your patient's treatment go down?
That comes with a little bit for more experience. However, obviously, if you are seeing less patients, you have a little bit more time to prepare for your next patient. You also, some therapists get really flustered in that setting where they kind of just, everything is moving parts and they have a hard time trying to put it all together. The most important thing, if you want to maintain without burning yourself out, is to maintain efficiency and to also take care of yourself. I'm a firm believer in, at the end of the day or end of the week, do something that you love. Something that doesn't require much brain power, or, something that you can just relax, I like to do yoga, for example, and I also, something very simple I like to do is garden. Because gardening doesn't take that much effort out of my mind. I like to, just water my plants, just check on things. Just simple things like that can definitely help you kind of de-stress. And even something so simple as just cleaning your pool.
Yeah, great answer. Thank you. So what type of patients do you least look forward to treating?
I kind of feel bad saying this, but I have a lot of patients that just think physical therapy services.
Can you repeat that?
That's because
Sorry.
I have a lot of patients that think physical therapists are just masseuses.
Oh, okay.
And this is pretty common amongst physical therapy, again, because most people don't know what physical therapists exactly do sometimes. Something would just do rehabilitation, something would just do massage. Then some come with that expectation that they need to have a massage to feel better. That kind of strays away from true physical therapy, because as true physical therapists, it's patient education and instilling confidence in your patient to get better. What that means is you're giving them strength therapeutic exercises and a home exercise program to continue to have them feeling better. Not just a one-off, you come here, let me do this quick mobilization and you're better. People believe that with mobilizations or massage, and then they get immediately better. But actually, there has been numerous research that states therapeutic exercise is 55% more, I believe that's a number, more effective than any other type of treatment. So again, it's about giving long-lasting effects to your patients. And I'm not against doing soft tissue work or anything. It's just that most physical therapists will probably tell you that some feel like glorified masseuses. And unfortunately, this has started a trend where less and less physical therapists are inclined to do soft tissue work because, again, they say, oh, I'm not a masseuse. They feel like they're being put down as
degraded. Yeah.
Yeah.
A follow-up question. So I was, as we all are on social media the other day, and there was an account that, screenshotted a tweet saying that physical therapy is actually just giving the body something to do until the body naturally treats itself, as if, and there was a bunch of, verified and, really good physical therapists that took it to offense, right? Imagine someone telling you, hey, your job is just, giving games or giving distraction to a patient until the body decides to heal itself. How do you feel about that?
I feel that might be misinterpreted because, again, tissues heal, right? No matter what, tissues are going to heal. Wolff's principle, stress causes induced healing. However, I understand why they would take fault of that because, again, no one wants to be diminishing a profession. But here's a great example. I have a teen with a type of patellofemoral pain syndrome, and their main issue is a biomechanical fault. Every time they squat, let me try to demonstrate. Their knee caves in, what we call valgus. And even going upstairs, they don't have any anterior trunk lean. Basically, they don't lean forward to recruit their glutes, and they have increased pain in their quads, and they never stretch out their quads. Now, will that patient heal? Probably, but will they heal to their maximum potential? Probably not, because they're going to continue to aggravate their symptoms because their biomechanical faults have not been adjusted. That's the true issue. Changing the movement patterns can truly cause a difference in what people are feeling. Another example of this is you commonly probably hear that, oh man, when you pick something up, never bend over, use your legs, right? You probably heard that numerous times, correct?
Yeah.
Does that mean I should never bend over at all? No. Should I work on my bending over? Probably. But in the time being that I have an injury to my lumbar spine, my low back, should I be using better mechanics to offload that injured area? Probably would be a good idea to allow for tissue healing to undergo without continued disruption.
Gotcha. And lastly, on this topic, I always, I watched a lot of medical shows, Grey's Anatomy. I don't know if you've seen The Good Doctor. It's about an autistic kid that, he's actually genius, but anyways, a common pattern with these shows is that, I don't think we would have to deal with it, but, they're at the hospital, they're trying to save a life, the patient dies, they come home and they're depressed. You know what I mean? Is the satisfaction of your work enough for you to go home, feel fulfilled, and sleep every night? Or do you wish, hey, I wish that patient took one more step? Or, hey, I don't know if, are you ever insecure about the progression that you give your patients?
Well, when I first started a little bit, but not much anymore because everything that I do, I give my heart and soul into. I treat all my patients as if they're my family. That elderly lady, treat her like she's my grandma. Middle-aged woman, I treat her like she's my mom. You know, like again, personally, I'm always hard on myself. Like I wish I could always do better. I think everyone else should always try to strive to be the best they can be. However, it's about understanding that you did your best that day and you continue to do your best that you can do. That helps you sleep at night. I used to work in a couple jobs that I wasn't sleeping well because I didn't enjoy what I was doing, you know?
Yeah.
But again, when you find that passion, where you find something that you truly love, again, consider physical therapy your career, not a job. People always ask me, Alondra, do you love what you do? Alondra, do you love what you do? I say, of course I do. I wouldn't have gone to that many years of schooling if I didn't. And I wouldn't have invested a lot of my life and money and time and all that to just be treating for a paycheck. Again, for me, it's a career. That physical therapist hat is always on. When I'm out in the malls, I do a gait analysis. Basically, watching people walk, how they're walking, why they're walking like that. I have to sometimes turn that off, because again, I'm out there trying to buy shoes, but here I am looking how Sally's walking.
Yeah, I can imagine myself do that too. It's knowledge that you find applicable to everything, so you just, it's your way of life, so you're gonna look at someone and be like, how could I, whatever. For sure, I can relate. So, next question, what type of patients do you most look forward to treating?
I love motivated patients. I love people that want to get better, that are striving to get better, people that they understand that we're in this together. I always tell them 70% is you, 30% is me.
Yeah.
Because they have to be motivated to continue doing their exercises. And again, talking about that previous, patient I don't like, I've had ones where I demonstrate their exercise after they only demanded a massage. I said, wow, I feel so much better. And I looked at them and I said, hey, imagine if you did that every single day. Then that kind of redirected them to understanding the true effects of therapeutic exercise and physical therapy and the power of physical therapy of getting them better. For me personally, I kind of like complicated cases. I see a lot of feet that I'll get, and I've seen multiple DPMs, podiatrists that couldn't crack the case, I like to say, or that I just see, and I like to work with them and figure out what's going on. I've had a couple, but great example, one patient who saw 4 different podiatrists, and they just couldn't figure out what was going on. Even though it was plantar fasciitis, they labeled it plantar fasciitis. All of them call it plantar fasciitis. But what they ignored was that the patient also had a posterior tibialis tendinopathy, which was causing the plantar fasciitis. So it was like a double conundrum. And again, for me to be able to put those pieces together, that really gives me a thrill. It's really fun. So
yeah, nice. So I would imagine like the athletic, those that believe in exercise as medicine are probably the ones that are most likely to work with you and repeat, their prescribed exercises. Or is that not the case?
Actually not.
No?
No. Everyone that always talks to me about physical therapy tells me, oh, why don't you work with athletes? Don't you love athletes? I mean, I come from a kinesiology background. I went to CSUN. I partaken in multiple different things. Before I even did physical therapy, I was an ACSM certified exercise physiologist. So I have a good athletic background and all that stuff. However, I just love to see like the middle-aged, the older generation, even the pediatrics, the people that don't really know what physical therapy can do for them, those are the ones that I love to help, because it's truly an eye-opening experience for them, and to see their reaction and to see their buy-in, what I call when they buy into physical therapy, is beautiful. again, I've worked with athletes in the past, and some of them, a lot of them, they tend to kind of, I call prima donnas. No, again, I'm not saying all of them, but because, again, the satisfaction is not as high because, again, they're a healthy young population. They're going to get better. They know how to do exercises. They've been doing exercises. So they're not, the buy-in is a little bit less. Obviously, you have to get them to buy in to believe in doing the work to get better. However, the fact that I can get someone that has never experienced the feeling of getting better to feel better is what I
Yeah,
like.
yeah. Because I feel like with those groups, you're more of a teacher too, and you learn by teaching, right? You remind yourself and you brush up. So, I can imagine how that can work for sure. Uh, so briefly, right? Maybe just a class or two. So I am going to CSUN hopefully in the fall if I uh pass all my classes currently, which I'm on track to do. But I'm registering for kin classes, right? And the whole series and the biomechanics and everything. So, what kinesiology class would you consider the most valuable or applicable to the work field? What should I pay extra attention to? This doesn't mean that other ones aren't important or they're going to be brushed off. They all need to be completed and, passed for me to move on. But what should I, tell myself, hey, Dr. Andre told me this matters for sure.
So definitely your anatomy and your physio classes, which I've told you when you first started as Nate, just concentrate on that because those are your bread and butter because you have to understand the human anatomy before you can even think about diving into treating a part of the body. But for me, I'm not sure if this other Cal States have the class I took, which was Kin 313 and 311. It was basically aquatic therapeutics, where you get a client and you're basically taking them through therapeutic exercises. Obviously, there's a teacher that oversees it all, but you are working one-on-one with someone that really needs help. And for me, I worked one-on-one with a spinal cord injury patient and a client, whatever. And it was really, really beneficial for me because, again, it kind of put in our roots for treating neuromuscular dysfunctions. It kind of got me really thinking about, okay, what can I do with this person instead of thinking about all the things I can't do, which often is the case with everybody always thinks that they're automatically honing into what they can do instead of what they can do.
Nice. Okay, so yeah, anatomy and physio, and kin 313 and 311 aquatic therapy. For sure. Yeah.
There's a land-based one. 311 is the land-based one. 313 is the aquatic one.
Okay.
But I know Season offered it, and again, go Matadors.
Yeah, for sure. All right. In your opinion, what does sports psychology, play as a role in being a PT? What role does it play?
Sports psychology is a huge part. Not even only psychology, like sports psychology, but psychology itself. Let me give you an example. If I constantly tell you, hey, you're weak, what are you going to think?
I'm weak.
You're weak.
Yeah.
But if I tell you, yo, your body is resilient, you're strong, you're going to have that mindset that you can do anything. Words mean a lot. The way you word something is completely game-changing. For example, if you come in, you have numbness or tingling, and I tell you, hey, how's your numbness and tingling doing? Right off the bat, boom, your mind's going to think about that. Versus, hey, how are you feeling today? Now you're thinking more globally than just honing into that numbness and tingling. Now you're thinking, okay, cool, I can do this. Or here's another example. Hey, how much pain do you have today? Okay, you're automatically thinking pain, boom. Versus, hey, how was your weekend? What were you able to do that you weren't able to do before? Now you're thinking positively. It's about really ensuring a positive mindset into your patients. It's about, again, empowering your patients with your words. So again, sports psychology is one of the most important things. And actually, this is a great quote that I actually read from Greg Popovich. He said, when out of a huddle, he never tells his star player, go out there and hit this three. Hell, what he says is, make good decisions. Why? Because now that player is only thinking about that one thing at three versus thinking about maybe if I'm doubled up, I'll dish it out for the three. And I give basketball analogies because that's the best way for me to break this down. But again, what you say and the words you reflect onto your patients make a huge deal. Sports, non-sports, it's applicable.
Do you find it tempting to give or not to give false hope? You know, obviously you're not, you don't have people that are bleeding out with bullet holes in their chest and, you know, the family saying, hey, are they going to make it? You know, you're not under that type of pressure, like for, you know, for example, for an ER surgeon, because that's something, I have family that is an ER surgeon, and they always, you know, they tell me one of the hardest part of their jobs is giving a neutral response, right? So how does that play into your work setting? You know, if someone comes in and they go, how long will it take? Will I get better? You know, those types of questions.
That's a tricky question, and people, again, they do come up to me and ask me how long will I get better, blah, blah, all that stuff. To be honest, I'm an optimist. So I always try to tell them the best, but I also am a realist, so I'll tell them this is what's expected. So you kind of want to, again, it's not completely about false hope. It's more about trying to give them a light at the end of the tunnel, to give them a direction. Because if you're not giving someone direction, then they're just going to be going around in circles wondering what if or why am I even doing this? And people get discouraged along the way. It's important to continue to remind them of why they're doing this.
Right. So previously you mentioned that you enjoy, instead of working with athletes, working with groups that have yet to know what physical therapy can do it for them. You mentioned if it's an elderly woman, you know, geriatric setting, it would be like your grandma, or if it was, you know, pediatrics or, so from your experience, what are the similarities and differences between geriatrics and pediatrics? Because they seem to be the two, you know, extremes of the
opposites.
Scope. Yeah?
I personally like pediatrics more than geriatrics. That's a personal preference, and actually in PT school there was a big divide. With both of them, you have to be creative. However, the big difference is pediatrics, they want to be quick. So you got to be creative with what you do. For example, I can't tell a 4-year-old to do 5 leg lifts. I have to turn it into a game. Kick this ball 5 times. Yeah. Or can you point this cone out 5 times? Versus an elderly patient, they kind of want more direction. They kind of want someone there to kind of assist them, but also not to completely make into a game, but more into their time spent with someone giving them attention. Well, based on what I've seen, most of the geriatric population, unfortunately, is alone, you know. And again, this comes from you and my background with my grandma. Oops, sorry about that.
Oh, good.
From background from my grandma. She spends most of her time alone. For her, when she would go to therapy, it would be her time to vent or just to, you know, go ahead and talk about her day. So it's a little bit different, but at the end of the day, your tissue is still healed. You're still trying to get whatever you can out of both populations to allow for the maximum efficiency in their tissue healing and their functional outcomes. Because again, without function, kind of things become redundant.
Yeah, that's not the answer I was expecting, to be quite honest, because I was thinking to myself, you know, they're both a little more hard to communicate with. They both wear diapers. You need to tie both of their shoes, you know. So, I mean, that's interesting, yeah, the way they answered. So we have 3 more questions, and 2 of them I could ask in in the same format. From our experience at working at Flex Motion, our brief experience, complications with my schooling did come. I did get sick. COVID was in the midst of all that. It was just bad timing, but I did learn a lot from working as your PTA and working in the setting as well. So, from what you observed, in the most honest way possible, what would you improve about me while I was your aide, and what would you want me to maintain, or what you enjoyed seeing?
So, one of my favorite things about watching you work was your patient rapport and the amount of time you spent with patients. However, that became a double-edged sword.
Yeah, it did. Yeah.
As you tend to get caught up in spending a little too much time chatting it up with a patient, when again, time management is key. However, people loved you because you show them that rapport and you show them that, hey, we're here to help you. So simply put, time management on both. So you kind of want to, again, watch your treatment times, because in a fast-paced setting, remember, one person is going to be done here, the next person is also going to be done here. How can I most efficiently work with both? Those are big things I would recommend that you continue to work on. And I think your shining star is the way you communicate with people and the amount of care you have for people. And I can generally see every time I see you work is that you do care about people and how much quality they're receiving.
Yeah, I appreciate that a lot, man. But that did bring, I'm not surprised to hear that, because, ever since I was in elementary school, middle school, my report cards would always say, talking excessively. Or I think I'd have to put a little bit of a dim on the social aspect. And, of course, when I become a physical therapist, I'm just not, it's not happy hour at the bar or at Coffee Bean, right? So
Yeah.
That's just a balance I think would have to come with time. So last question. If you could leave me with one thing to remember from this interview, what would it be?
The one thing I would like for you to always remember is, really think about your why. Why do you want to be a PT? Why do you want to help people? Are you willing to manage your time to be able to understand that, again, you're a human. You're not a robot. You're going to need breaks or you're going to burn out. But the main thing I do want you to remember, and always remember, because, again, I do see a lot of potential in you, is to always, always, always think of the why.
Thank you, man. I appreciate it a lot. So, I enjoyed this interview a lot. I'll definitely have some fun looking at the recording and, filling everything in. As always, thank you so much. And, best of luck in your ventures as a PT.
Of course. Thank you. And feel free to reach out anytime if you have any other questions. And you have a wonderful night.
Yeah, and for just your information, this recording is going to be uploaded to the YouTube, so I could upload the link for the assignment. And if the professor does reach out to you, I let him know that you're going to be in Armenia, but I think he can probably email Flex Motion or give them a call.
Yeah, feel free to shoot me an email, my personal email as well. I will be on a mission trip in Armenia, working with the wounded soldiers and stuff. However, I should be able to answer emails, so I will be taking my laptop with me. Whatever I can do to support, as one of the main things, actually, to add on to the last thing that I want you to always remember, is to always pay it forward. That was something that was, really taught to me growing up, going up from my bachelor's all the way to my doctorate, was pay it forward. Because you never know, one day that you may touch someone's life and you may make someone's day a little bit brighter.
Nice. I love that. Thank you so much, and have a great rest of your day.
You too. Take care.